Kia ora koutou, my name's Sharnee Diamond. Thanks for the funding from ANZ Private Scholar and the Otago Medical Research Funding. I was given the opportunity to work on a very important project focusing on our ageing rural population and the types of support that they need to age in place. This short film will provide some detail of our project. By now it is common knowledge that our population is sticking around for a lot longer. With this increased aged population, it will be logical to assume that the age-specific support would also increase, corresponding to the various governmental policies which encourage New Zealanders to age in place in their communities. Of the social and healthcare services available, what can be said about the 14% of New Zealanders that live rurally?
There are a lot of costs associated with living in rural areas which are not even considered by people in urban areas. Older people can feel quite isolated and left out of things. Their status diminishes in New Zealand.
So for this project we partnered with Aged Concern Otago. I headed to Central Otago to conduct semi-structured interviews with both older folk and their support workers, gaining access to the real life experiences of older folk living in rural areas.
So we found that there was evidence of people who were lonely and isolated. We found evidence of people who realise that they need help, aren't quite sure who to call for that help. We also found evidence that although there are some good agencies working in the area, there's not always the joined upness.
So that no matter which career you choose or which research area you're in, you're going to age. It is our aim with this research and more to call on local and national governments to ensure that they are providing sufficient resources for those agencies and frontline workers who are dedicated to supporting ageing populations.